You hurry across a parking lot with grocery bags, and instead of chest pain, your jaw starts aching. You stop for a minute, it fades, and you tell yourself, it must be your teeth. That is exactly how heart disease hides. In the United States, heart disease causes 1 out of every 5 deaths, and the CDC warns that it can stay silent until the day it shows up as a heart attack, heart failure, or a dangerous rhythm problem. That silence is what makes it so costly. For adults in their late 50s, 60s, and 70s, the first clues often look ordinary. You get winded sooner. Your legs feel heavy. You need an extra pillow at night. You feel wrung out after chores that used to be easy. It is easy to blame age, stress, bad sleep, or being out of shape. But sometimes those small changes are your circulation, your blood vessels, or your heart trying to get your attention years before a crisis. And the real fear is not just a diagnosis on paper. It is losing your independence, a little at a time. It is avoiding stairs, skipping walks, sitting out family trips, feeling too tired to drive, garden, travel, or keep up with the grandkids. When blood flow drops, when arteries stiffen, when the heart has to work harder, daily life gets smaller long before anyone says the words, heart disease. One of the most overlooked signs is jaw pain during exertion. If your jaw, neck, throat, upper back, or arm aches when you walk uphill, carry something heavy, or hurry, then eases with rest. That can be part of the angina picture. The reason is simple. When the heart muscle is not getting enough oxygen, the pain is sometimes referred along nearby nerve pathways, so you feel it in the jaw instead of the chest. Another quiet clue is swollen ankles by evening. If your socks leave deep marks, your shoes feel tighter at night, or your lower legs puff up late in the day, that can happen when the heart is not pumping effectively and fluid backs up into tissues. It can have other causes too, but new or worsening swelling is not something to shrug off. Persistent fatigue matters too. Not ordinary tiredness, but a new pattern where simple chores wipe you out, or a short walk leaves you needing to sit down. When the heart struggles, less oxygen-rich blood reaches muscles and tissues, so the body starts rationing energy. Then there is the irregular heartbeat that shows up when you are resting quietly. A flutter, a thump, a skipping sensation, a racing spell while sitting in a chair or lying in bed can point to an arrhythmia. Some rhythm problems reduce how efficiently the heart pumps, and repeated episodes deserve medical evaluation, especially if they come with dizziness or faintness. Shortness of breath when lying flat is another classic clue people miss. If you need more pillows than you used to, feel air hungry when you lie down, or wake up suddenly breathless, that can happen because lying flat shifts more blood toward the chest, and a weak or stiff heart may let fluid back up into the lungs. For men, erectile dysfunction can also be an early vascular signal. It is not proof of heart disease by itself, but the same blood vessel damage and plaque buildup that affect the heart can affect erections first, partly because those arteries are smaller. That makes it a useful warning flag, not just a bedroom issue. Cold feet can mean many things, but when cold feet show up with calf pain while walking, weak pulses, shiny skin, or slow-healing sores, think poor circulation. Peripheral artery disease means narrowed leg arteries, and it often signals atherosclerosis elsewhere too. In other words, it is not just a leg problem. A diagonal crease in the earlobe is an interesting one. Researchers have studied it and found associations with vascular disease in some observational studies. But this is important. It is not a diagnosis, and it is not part of standard screening. Think of it as a clue that may be worth noticing, not a verdict. Gum disease belongs on the list too. Bleeding gums, loose teeth, chronic inflammation, and persistent bad breath. May seem like a dental issue only, but periodontitis is a chronic inflammatory condition. Bacteria and inflammatory signals from diseased gums may enter the bloodstream and may contribute to vascular inflammation. The link is real enough to take seriously, even though gum disease alone does not tell you how much heart trouble you have. And then there is sleep apnea, one of the biggest hidden drivers. Loud snoring, pauses in breathing, gasping at night, morning headaches, daytime sleepiness, and blood pressure that stays hard to control all matter. Repeated drops in oxygen during sleep can activate stress hormones, raise blood pressure, impair blood vessel function, and are linked with rhythm problems like atrial fibrillation. The good news is that these signs are not a message to panic. They are a message to pay attention early, while you still have leverage. Food will not cure serious symptoms like breathlessness, lying flat, exertional jaw pain, or recurrent palpitations. Those need medical attention. But the same daily choices that affect plaque buildup, blood pressure, inflammation, and blood vessel function can absolutely support your heart and lower risk over time. A strong place to start is extra virgin olive oil, not as an extra splash on top of a poor diet, but as a replacement for butter or refined low-quality foods. Research on Mediterranean-style eating patterns supports cardiovascular benefit. And extra virgin olive oil is rich in monounsaturated fats and polyphenols that may improve endothelial function, reduce LDL oxidation, and lower inflammation. A practical range used in many trials is about 2 to 4 tablespoons a day as your main added fat. Next, keep unsalted nuts in the house. Walnuts, almonds, and pistachios are simple tools because they can replace processed snacks and foods high in saturated fat. They bring unsaturated fats, fiber, plant sterols, minerals, and polyphenols, and walnuts also provide ALA omega-3. A practical target is about 1 ounce a day, roughly a small handful. For breakfast, think oats or barley instead of sweet cereal, pastries, or toast made from refined grains. Steel-cut oats, old-fashioned oats, oat bran, and barley contain beta-glucan, a soluble fiber with consistent LDL-lowering evidence. Research shows that 3 grams a day or more of oat beta-glucan can lower LDL cholesterol, with one meta-analysis finding a reduction of about 0.25 millimeter per liter. Roughly 1.5 cups of cooked oatmeal, plus oat bran or barley, can help you reach a useful intake, depending on the product. Beans and lentils deserve a bigger role too. Lentils, black beans, chickpeas, and cannellini beans can replace red meat, processed meat, or refined starches at several meals each week. They help because their soluble fiber supports lower LDL, their slow-digesting carbohydrates are easier on blood sugar, and their potassium and magnesium support blood pressure. A practical target is at least 4 servings a week. Then build more meals around leafy greens and beetroot. Spinach, arugula, romaine, Swiss chard, and beetroot are rich in dietary nitrate, which the body can convert into nitric oxide. Nitric oxide helps blood vessels relax and widen, which supports blood flow and healthier blood pressure. Studies often use concentrated beetroot juice around 140 milliliters, or nitrate doses around 6 to 13 millimeters. If you take nitrate medication for angina, or your blood pressure tends to run low, that is something to discuss with your clinician before using concentrated beet products. The bigger pattern matters just as much as the individual foods. Diets high in sodium, ultra-processed foods, refined grains, added sugars, and saturated fats push the body in the wrong direction. So every swap counts. Olive oil instead of butter, oats instead of a sugary breakfast, beans instead of processed meat, a handful of nuts instead of chips, greens on the plate instead of another refined side dish. And do not ignore sleep. If snoring, gasping, and daytime sleepiness sound familiar, get that checked. Sleep apnea is not harmless noise. In older adults, a 2024 study found that sticking with PAP treatment was associated with lower mortality and fewer major cardiovascular events. Sometimes protecting the heart starts at night. This week, do 3 simple things. Pay attention to what your body does when you exert yourself, when you lie down, and when you walk. Stock your kitchen with one heart-supportive replacement, like extra virgin olive oil, oats, or unsalted nuts. And if you recognize one of the stronger warning signs, especially exertional jaw pain, new ankle swelling, breathlessness lying flat, or repeated palpitations, make the appointment. You do not need to guess, and you do not need to wait for a disaster to take your heart seriously. Small signs count. Small food changes count, and the earlier you respond, the better your odds of protecting your energy, your mobility, and your time with the people you love.